The supplies for your CPAP or BiPAP therapy are all called durable medical equipment (DME). This means that they are for more than a single night of use. The company providing these is called a DME provider. Opry and Sleep Data are two examples of a DME provider. These DME providers are contracted with your medical insurance to supply you with CPAP equipment. Your insurance has agreed to pay the DME a set amount for each piece of CPAP equipment. Often the contract is an exclusive contract between your insurance and the DME provider. Using another DME provider can often lead to your having a higher out-of-pocket cost. We will always send your prescription to a DME contracted with your insurance in order for you to minimize your cost. Some DME providers are only located on the internet. For these providers you must contact the providers and fax the prescription to them. As with many web-based retailers, their prices may be lower, but you often have to pay the full amount yourself and get reimbursed by your insurance. Opry and Sleep Data will bill your insurance directly and save you the trouble of doing this yourself. It is important to understand the difference between the Imperial Valley Sleep Center and your DME provider. Dr. Wolcott is your treating physician. He provides your initial evaluation. The sleep center performs the appropriate testing. He prescribes the equipment or medicines you may need. The DME is like a pharmacy. Instead of providing medications, they supply the medical equipment such as CPAP or oxygen. Just as a pharmacy is not part of the doctor's office, the DME is not part of the Imperial Valley Sleep Center. A prescription is prepared while you are at our office for an appointment. This prescription specifies what equipment will be provided to you. Your prescription, which Dr. Wolcott sends to the DME provider, is good for 12 months. After 1 year, a new prescription must be sent in order for you to continue getting supplies. The prescription will commonly include orders for a replacement interface, nasal mask, full face mask or nasal pillows, a replacement cushion, hose, filters, humidifier chamber and chin strap are addition supplies ordered. Each of these have a replacement schedule which can be provided to you so you understand how often they can be given to you. We fax the prescription to the DME at the end of your office visit with us. When the DME provider receives this, they get an authorization from your insurance. Once they have the authorization, they will wait for you to contact them. Once you have called them and asked for the supplies to be sent, they will mail them to you. It is important that they have your current mailing address. You should also notify them of any changes in your contact information such as phone numbers and email. You must understand that for the DME to send your supplies, you must tell them that you need them. They cannot mail supplies to you unless you have told them to do so. Many health insurances require that you request the equipment before the DME can send it to you. All CPAP supplies will be sent by mail. You can pick up the supplies at Opry only if special arrangements have been made in advance.